Dan, it's great to have you on NephTalk. Welcome aboard.
Thank you, Chris. It's great to be here. Looking forward to chatting with you.
I would first like to share with the audience a quote that I found in your email signature file. Know what your customers want most and what your company does best. That's not just an intersection. That is a point of collaboration and partnership, as in, wouldn't you like to work with us? From both sides of the table. Would you agree?
Absolutely. That quote struck me when I read it not too long ago. It's by Kevin Sturtz. It couldn't be more on point for a service organization that's looking to grow through partnerships with third parties. It's incredibly simple, but incredibly on point.
You started with Satellite Healthcare earlier this year as Vice President of Business Development. Congratulations.
Thank you.
However, you spent a decade, over 10 years, in the kidney care industry and are currently charged with growing Satellite's business in existing markets plus new markets on the East Coast. Let's discuss your strategy, short and long-term goals, and how you will engage doctors, nephrologists, various group practices, and hospitals, and build name recognition for Satellite Healthcare.
It's been a great start to my career here at Satellite over the last several months. Like you said, I have 10 years experience in the industry, both on the operations and business development side. And Satellite has been a really welcomed addition for me. As a not-for-profit and mission-driven business, Satellite's dedicated to securing better health outcomes by providing high-quality, individualized care for every patient, every treatment, every time. So when we look at our mission of making life better for those living with kidney disease, we focus on a lot of things that are quite simple. Quality, making sure that patient satisfaction rates continue to be the best in the industry, which they are. 78% of Satellite centers were rated 4 out of 5 stars by patients. And as a physician-led, almost 50-year-old company with a patient-centered approach, we're really proud of our clinical performance.
And by the way, those ratings come from CMS, the Centers for Medicare and Medicaid Services. What are Satellite's strong points that differentiate the company from other dialysis services providers in the market? And I believe this is an enormous part of how you present yourself and the company to potential clients.
It's a great question. The reality is nephrologists are facing a shifting environment in today's world. There's a strong push for a higher percentage of patients on home modalities. There's a big move towards CKD management or chronic kidney disease management as compared to just dialysis treatment. And the healthcare industry as a whole is moving towards a value-based world environment. So some of the benefits of Satellite is that we've been focused on home modalities and a strong push for patients treating at home for decades.
Satellite Healthcare has a solid footprint in California and, of course, a presence in Texas, Tennessee, New Jersey, and Hawaii. And it's quite important, frankly, for the company to continue to expand their reach into new areas of the country. You will be focusing on the East Coast. It's not as if you're going to open up a dialysis center. So I should think that part of the strategy will be to work on persuading nephrologists, practices, hospitals to adopt home dialysis as will be provided by Satellite Healthcare. Is that a fair assumption on my part?
A big part of what we do is push towards home. We do provide dialysis services across all modalities, in-center for our hospital partners, outpatient dialysis centers, and then a combination of outpatient and home modalities through our Wellbound model, which is our home and PD dialysis centers. And our strategy really is to talk to everyone, to create relationships. Because on the nephrologist side, they may be frustrated in their current environment because of the shift towards value-based care. Hospitals are looking to get more involved in the kidney care space. We were chosen by CVS to be their partner for their kidney care space. We recently signed an agreement with Outset for their Tableau machines, which again are focused heavily on moving patients towards home services. As we reach out to nephrologists, hospitals, health systems, our approach is the same. Where can we help you from a dialysis perspective, a CKD management perspective, and are there things in your market that we could expand your services with? In addition, Satellite has a very strong research arm through their Applied Pragmatic Clinical Research Program, which, as a not-for-profit, a lot of our profits go back into research, which is also a strong opportunity for nephrologists that are interested in that as well.
It's also a component of Satellite Healthcare's nonprofit status.
With the research, we put a tremendous amount of money back into not only the research program, but new innovations. Things that we're working on currently are assisted PD. We're working in a self-care model where the patients do a lot of the treatment themselves, both in-center and at home. And then an optimal transitions program to try and take patients straight from a hospital environment to a 4-week training program to educate them on their modality options and try and get them to a home environment as compared to just treating in the center.
You told me that you've been very warmly received. You've been in the industry for 10 years with a fair amount of name recognition, and you've also mentioned that several potential clients said that they perhaps are looking for a company to work with that is more reachable, a little more nimble. Can you address that?
As I'm reaching out to physicians, groups, hospitals, and health systems alike, I'm finding that in many cases they're just looking for a new approach. And some are looking for another opportunity to expand services, particularly when it comes towards high-quality patient care and home modalities, which has been the staple of Satellite for almost 50 years now.
Well, the organization, Satellite Healthcare, has, as you said, a nearly 50-year proven track record of delivering high-quality, compassionate care, which translates into positive patient outcomes as reflected by the patient satisfaction ratings and quality care star ratings from CMS, the Centers for Medicare and Medicaid Services.
The reality is, for Satellite, home dialysis has really been our calling card for a very long time. And as a result, we have more patients using home therapies on a percentage base than anybody in the industry. It also, as you mentioned earlier, supports the executive order of trying to get more patients home, advancing American kidney health as it represents the future direction of kidney care. We think these elements are very scalable, and it makes the right time for us to bring our services to a greater percentage of physicians and patients in the country, both on the East Coast and other parts of the U.S. as well. If they can treat at home, the benefits there are they can treat at their own time. They typically feel better after treatment because the treatments are slower and for a longer period of time. So there are a lot of clinical benefits to them treating at home, which again supports the Satellite healthcare model of getting as many patients at home as possible.
What are your next steps?
The most important thing is have a discussion with nephrologists, hospitals, healthcare systems. What are their goals for the next 3 to 5 years? Where are they looking to improve their CKD management? Where are they looking to improve capacity for patient care in the dialysis world. For nephrologists, I'm looking to talk to doctors that are either unencumbered by existing contracts or non-competes, or they have a change in situation, either a contract expiring or an opportunity outside of their current non-competes becomes available. These are the relationships I'm looking to build. My discussions are 1, even 2 years in the making, which is why it's so important to start talking now. We have a variety of academic and health system partners throughout the country, and there's a variety of partners that we've spent years developing, and we're looking to do the same with doctors and health systems throughout the U.S. There's an interesting opportunity for Satellite at this point in time because of the strong focus on getting more patients home and continuing to increase treatment and quality of life for those patients.
Speaking of quality and qualities, listening and empathy seem to be two qualities that you possess in abundance.
Thank you, Chris. Appreciate you giving us the opportunity to talk about Satellite and our growth strategy, and looking forward to talking to potential partners in the future. For those that may be interested in reaching out to Satellite Health, there's an email called partnerships@satellitehealth.com, and they'll get in touch with the right person at business development that fits your needs.